may begin.
All right. Thank you, David. Hello, I am Linda Heitzman-Powell, and I serve as chair of the Behavior Analyst Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. Today is Friday, August 15th, 2025. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being held remotely by conference call and other electronic medium. Denise Seisman.
Present.
Allison Bell. Alec Bernstein. Alec is present, but he will be in and out due to work commitments. Wes Dotson. Kelly Harris. Son.
Here.
Sorry, Kelly.
You're okay.
Emily Kessler.
Here.
Pamela Neidert.
Here.
Pickwa Lamb Chestnut.
Here.
And Alice Zhang.
Here.
I note the following BSRB staff member is also present. David Fye.
Here.
Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Linda. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about concerns, but the Kansas Open Meeting Act does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no time reserved for public comment today, as no individuals requested time for public comment. Because we are conducting this public meeting remotely, I state for the record the following information. Access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call or by viewing the board's YouTube channel. While the meeting is conducted remotely, the requirements of the COMA are not suspended. As such, we will be conducting this meeting pursuant to the COMA. On June 23rd, 2025, we sent notice of the meeting to all individuals who had requested notice of such meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And Linda, I did check the conference call line before we got started. There's no one currently on the line, but if I hear someone beep over and introduce themselves, I will let you know.
Okay, thank you. So the meeting is now called to order, and the advisory committee will begin its discussion of the first item on the agenda, which happens to be the agenda approval.
I move that we approve the agenda as presented.
Okay, thank you,
Emily.
Denise.
Emily seconds.
Thank you, Emily. Is there any opposition? Nope, the motion carries and our agenda is approved. So now we want to welcome our new advisory committee member, Pickwa Lamb Chestnut. And so Pickwa, you know me.
Yes.
So I don't have to introduce myself to you. Can we go around, David? Is that fine? And
That sounds great. Yeah.
give a little piece of information about ourselves. So
Sure.
I'm gonna skip over you, Pickwa, and go to Alice because she's the next one, and then we'll let you speak last. So Alice.
Yeah, and hi, do
Pickwa.
you go by Pickwa for
Yes.
first name? Oh, perfect. Thank you. Yeah, my name is Alice Zhang, and I work at the University of Kansas Medical Center and as a faculty there, and I'm primarily doing research and but also do a little bit of clinical work related to parent training. So that's me. Nice meeting you.
All right, the next one in my camera is Denise.
Piqua, Denise Sisman. I am the public member for this committee. I also, though, in my day-to-day life, serve as the executive director of the Kansas chapter for the American Academy of Pediatrics. So behavioral health is very important to the kind of work that I do. And I'm a fairly new member as well. So I think this just finishes my first year. So welcome. And I know you're going to really enjoy being a part of this group.
Thank you, Denise. Pam, you're next.
Hi, Piqua. And hi, Denise. I haven't met you formally either.
Oh, oops.
Piqua, welcome to the committee. I'm Pam Neidert. I am a faculty member in the Applied Behavioral Science Department at the University of Kansas. And I serve as the director of the Edna Hill Child Development Center that has graduate student and undergraduate student training in behavior analysis service provision.
Thank you, Pam. The next one is Emily.
Hi, Piqua. My name's Emily. I actually come from to the field from the education side. So I worked as a special education teacher and then became a LBA several years ago. I've been on this committee for several years, but I primarily work with schools and I help support multi-systems of levels of support through behavior, social, emotional.
Thanks, Emily. Alec, are you back yet? All right, we're going to skip Alec and go straight to you, Kelly.
Hi, I'm Kelly. I am a behavior analyst. I do in-home services for kids with autism mostly, and working for a company used to be called Kansas Behavior Support. We just recently rebranded to Heartland Behavior, so you might see both names kind of floating around out there. But our basic mission is to get services out into rural areas of Kansas. So I do some telehealth, some in person, and then I do some independent contracting on the side as well.
Thank you, Kelly.
Mhm.
And then since Alec is not here yet, he had to take care of an emergency. I'll pass it over to you, Piqua, and you can let the committee know who you are.
All right. First, thank you for this opportunity. I was excited, and then I appreciate all the feedback. I did watch last time's recording. It is, I have to admit, it's a little bit interesting and feels a little bit funny when people are talking about you and your background. But I have a pretty wide background. I was a general ed teacher in Hong Kong, and my class size is 45. And then that was about 15, 20 years ago. And then we started inclusion and with a general ed background, and I don't know how to teach these kids in my classroom. And then all the recommendations that I got for accommodation is extra time on the exam. And then I'm like, okay, I can give them eternity in this world. They won't be able to do it. How can I help them? So I started my journey in kind of special education by coming to the University of Oklahoma to get my master's. In special ed, and then that program was just 1 year. I plan to take 1 year and go back to teach. But then I just fall in love in this field because there's just a lot to learn. I keep learning, and then eventually did my PhD, and then I fall in love. I was always interested in kind of the behavioral side of everything. So found ABA and then just kind of got down that road and never come back. So that's kind of my journey. And then, so right now, I've been different states. I came to the United States in Oklahoma, and then I've been to Mississippi, and I stayed a couple of years there, and then South Dakota, and then now I'm here. I feel like I found home here. This is a little nice spot that's very close to my husband's family in Oklahoma. So I plan to we don't plan to move. And then I connected, very strongly and with the Kansas population and everything. And so right now I am teaching at the University of Central Missouri. We recently kind of inherited the ABA program from our psychology department, and then Linda probably know all that. And then so we are kind of new and trying to get accreditation in that process. And so my main job right now is really to teach and do research in the ABA area and SPED as well, and teach the graduate level ABA courses and then work on the accreditation on that.
Yep.
So that's kind of a little bit about me. If you have questions, let me know. And then
Thank you.
thank you for, having me on the board. I'm excited.
Well, we're excited that you're here, right?
Yes.
Alec, are you back yet? Going once? Alec? Going twice? All right, so Alec is one of our illustrious members who, is he at Children's Mercy? Yeah, so he's at Children's Mercy, and he graduated from the department over there at KU Lawrence campus, and so he's, been immersed in behavior analysis for a while now since his graduate program. So he's a key member of the team. He just happens to be in an emergency right now. So anyway, you'll meet him as we go along the way. So
I'm back.
welcome.
Thank you.
Oh, you are? Okay,
I caught
Alex.
the tail end of that. You made me sound really good.
There we go. You're our illustrious member. So did I leave anything out?
Not that I heard. I'll have a camera during our next meeting. I should have this whole setup redone now. Thank you.
Okay, thank you. All right. So David, I'll turn it over to you for expectations for advisory committee members.
Right. Well, thank you,
Oh,
Linda.
wait, David, why don't you say who you are? Duh, what an oversight. Sorry, David.
No, and that's no problem at all. Happy to do that. Yeah, I'm David Fye, Executive Director for the Behavioral Sciences Regulatory Board. And in my role working as Executive Director, I oversee the licensing staff and the investigative staff here in the BSRB office. There's 12 of us in total with all the staff for the agency. And then I also help facilitate board meetings and then to facilitate the work of the board, since we regulate 7 different professions. We have advisory committees set up for each of the 7 professions, and I work with the different chairs of those advisory committees to make sure that we have these meetings every couple of months, and you have an opportunity to talk about items that the board has referred to the advisory committees, and then also you have discussion about other topics that you may want to initiate on your own and then refer to the board. And so my background is not in behavior analysis, but I have done my best to try to learn about all 7 of the professions regulated by the board. My background is more of, I went to Washburn University and was a political science major, and then received a bachelor's of business administration and economics and management, and then went to Washburn Law School and graduated with a Juris Doctorate. And so I am a licensed attorney. And those skills do come in handy. Prior to this position, I worked for the Legislative Research Department over at the Capitol, primarily as a principal fiscal analyst, reviewing agency budgets, staffing committees like House Appropriations, Senate Ways and Means, and a number of the health committees, and gravitated towards the health agencies. And that's how I initially became familiar with the BSRB and all the health interactions between the different agencies. And so I came on board when the board hired me about 5 years ago. It'll be 5 years in November, and it's been a great experience, but I feel like in some ways I'm just kind of scratching the surface in terms of some of what the agency I think we can do. And we've got a number of different things going on. We're transitioning to a new licensing system. We have updated the agency's website in the last year. We are partnering with different groups and associations. And so really excited about the future. But if I can help you in any way in terms of becoming more comfortable in your role as an advisory committee member, just let me know. Happy to connect you to anyone in particular too, but feel free to reach out to me by email or give me a phone call and we can help you get all squared away. So with that, I'll go ahead and move to the next item on the agenda, which is expectations for advisory committee members. And we will do a training for all members. We hold that once a year. And we usually in the past, what we've done is we've done about an hour-long training session. Sometimes it's gone as far as an hour and a half in terms of going over all the different rules that need to be followed when you're a committee that's associated with a state agency. Under the laws of Kansas, there's certain rules as far as if there is interactive discussion that would involve a majority of members of a group, and it would be on a subject matter relevant to the work of the group. That is something that would need to take place during an open meeting, and that's under the Kansas Open Meetings Act, or the KOMA. I talked a little bit about that during the introductory information, but we'll go into more detail during the formal training. But if you're not used to working with a state agency or a group associated with one, you may be familiar with other groups where maybe they have a meeting and then in between, some of the members of the committee email back and forth and kind of coordinate work. In this context, you need to be cautious of that and avoid any kind of email communication or phone calls or even in-person meetings if it would involve a majority of members of the group, and it would be interactive conversation or dialogue, and it would be about the subject matter relevant to the advisory committee. So should you be at another function and you see a majority of members socially, that's fine. Just avoid talking about things relevant to the advisory committee. And if you want to reach out to me, you're always welcome to do that. If you want to reach out to Linda or a couple of members of the advisory committee to ask some questions or talk about something, that's perfectly fine too. It really just becomes an issue when it involves the majority of members of the group. So just kind of wanted to set the stage for the COMA. We'll get into a lot more details, but we tend to handle all the procedural things here in the office. So we put out notice about meetings and everything like that. But I just kind of wanted to make sure you didn't get caught off guard by that requirement of the COMA. The other one that I always try to let people know about right away is the Kansas Open Records Act, the KORA. And you're all professionals, so you probably don't need this as a reminder, but I still say it once a year. Just be mindful that all of your communications related to the BSRB could potentially be considered records and could be subject to a KORA request potentially. And so some people think about records as, official business letters or documents or reports, and that's true. Those are types of records, but also email communications can be records too. And so just always stay professional in your dialogue and your communication, and it shouldn't be an issue. And if you ever get a request from someone and it comes directly to you, just alert us to that and we'll assist you with that and make sure that we're following our legal advice in terms of how we respond to those types of requests. So in terms of the more formal training, what we've done in the past is we've held those formal trainings during an advisory committee meeting. However, since there's 7 advisory committees, it means that I go to the same training about 7 times over the course of the year. And we're trying to look to be a little bit more efficient with some of that time, because it also means that when we do those in advisory committee meetings, if the meetings are only 2 hours, it chews up half the time for an advisory committee. And so you can't use all of your time to discuss the other things relevant to your work. And so as an alternative this year, what I'm going to do is next month in September, I'm going to put out 4 dates, and I'm going to try to stagger those on different days at different times. And I'm just going to ask that all the members of the board and the advisory committee sign up for one of those 4 dates. And then whichever one works the best for your calendar, go ahead and sign up for one of those training opportunities. And then we will cover the same material at all 4 of them. So they're going to be a blend of the advisory committees between the 4 dates. But that way we can save the time for the advisory committee meetings and also make sure we do the annual training. So I'll put out more notice about that next month, but just be on the lookout for that. And I'll have probably a couple of them in the evenings, because I've heard that some people may not have a lot of flexibility during their workday. I'll probably put one of those during the lunch hour, so probably at noon. And then the other one I'll try to look for when a pretty good time is based on meetings and things like that. So, but in terms of other expectations, the way to get a lot of benefit from serving on the advisory committee is to come to as many meetings as you can. So as much as possible, just make sure that you review materials prior to the meeting, come and be willing to share your thoughts and discuss. And that really leads to a lot of really good productive dialogue at these meetings. And like I said, if you have any questions, feel free to reach out to me. If I can't assist you myself, I'll connect you with another member of my staff who can, or we'll ask for a board member to help out as well. So, and I'll turn it back over to you, Linda. If you have any additional expectations for advisory committee members, feel free to share that as well.
Yeah, I just think the big thing is you're in good company here, Piqua, because we're all a pretty vocal group. And so, we all want to make sure that we have the best system in place in Kansas possible to not just support behavior analysts or assistant behavior analysts, but also make sure that we're putting protections in place for the public so that people are benefiting from our services and that we're doing no harm. So we've been doing a lot of work on our regulations and whatnot. So you're joining at a good time to be able to add your voice to what you think is a good outcome. So anyway, welcome. Thank you, David, for that. Are there any other questions? Nope. All right, so we will go on to our next item on the agenda, which is the approval of the minutes from our June 13th meeting, which was Friday the 13th.
I'll move to approve those minutes.
Thank you, Kelly. I would entertain a second.
Emily can second.
Thank you, Emily. All in favor? Aye.
Aye.
All
Aye.
right. Opposed, same sign. I learned that from the BSRB committee that you say same sign. And that was not even direct instruction. I hear no opposition, so we approved the minutes, David. From there, now I'm going to hand it back over to you for the executive director's report.
All right. Well, thank you, Linda. At your advisory committee meetings, I always try to give some helpful information as it relates to the work of the BSRB. By the way, I also see that Allison is logging in from the waiting room, so she is now in attendance as well. And Linda, before I begin, do you want to have Allison go ahead and introduce herself to?
Yeah, I do. Thank you.
Great.
Hey, Allison.
Hello, I'm so sorry. I had an IEP meeting that I knew I shouldn't have scheduled right before this.
That's okay. We have our new board member or advisory committee member here today, Piqua. And so we went ahead and did introductions. Would you give Piqua a little bit about who you are and how you got here? And
Sure. I'm Allison Bell. I run a small outpatient ABA clinic in Wichita. I also serve IDD crisis stabilization for Sedgwick County, and I generally get voluntold to do many of these things. So I also am the founder of our Kansas Grassroots provider advocacy group here in Kansas. So that's how I got here. And Linda voluntold me.
all right. Thank you, David, for that opportunity.
Well, I'll go ahead and provide an executive director's report. So we'll start first with some updates on BSRB operations. One highlight I wanted to make sure you were aware of, we received a nice compliment on our agency's website. Over the last year, we made a big transition from our previous website hosted by Sitefinity to a new website through Granicus. And as part of that transition, we reworked some of our displays and some of our accessibility for the website. And so there were a number of meetings and a lot of work that took place behind the scenes to launch the new website. But we had a few goals in mind. And one of those was to make the website a bit more user-friendly. And so we added some ways that people can get to the information that they might want a little more cleanly from the front page. We also designed it in a way that looks a little bit cleaner using mobile devices. We know that there's been a transition from people using a lot more desktop computers to laptops to now a lot of the internet accesses by people using their phones. And so there was some intentionality about the way that it looks and a way that it fits when people are looking on the website on their screens. And then we tried to kind of clean up some of the postings. And so there was still the same information that you could get to, but we didn't want to have it be quite so busy. So maybe a cleaner interface, but also still allow people to get to the information if they wanted to see it. And so we did those things in mind, and we recently received a note from the Association of State and Provincial Psychology Boards, ASPPB, that they came out with an article praising 10 agency websites between states and Canadian provinces, and the Kansas BSRBs was one of them that they were praising for being user-friendly. So really happy to see that. It was noted under two different categories, and they were saying that some of the way that we sort information on some of our websites, but having some of the frequently asked questions sections and having sort of our drop downs where you can navigate to different things was helpful in terms of their ability to find information on our website. So just wanted to share that. There's a number of staff members who worked on moving the new website over. And so just kind of wanted to bring that to your attention. We've got some positive feedback and wanted to share it with you. In terms
That's
of
a lot of websites to comb through for them to select ours randomly from the United States and Canada. So
yeah, well, the ASPPB, they have all of the United States, the provinces, and also the territories. And so they interact with a lot of different jurisdictions. And yeah, they were just doing a project and looking for how to find information on the different websites, and they were praising the BSRB one for being more user friendly. So I was nice. It was nice to hear that. That was our goal, and so it's good to get that feedback. So.
Very cool. And how random and very cool.
Yeah. So we actually we put a note on our website linking back to their article. So if you do want to read the full article from ASPPB, there's a note on our website to get to that article. Moving next to CE Broker update. At the last meeting, we talked a little bit about CE Broker, and that just to kind of summarize that last year the board decided to partner with that company. They offer a free service to licensing boards and also to licensees by providing an account that, if activated, people can go through and upload documentation that they've completed their continuing education hours. The goal is that if they are selected for audit and they would need to demonstrate completion of the hours, if they're using the CE Broker account, they can notify the board, and then we can go into the portal and check the hours, and it allows us to complete the audit more quickly than the traditional method of sending things back and forth. It's also a nice benefit to licensees. Instead of making sure that you're keeping all those records in one place, like on a shelf in terms of paper records or in an email account, this is a nice resource so that you know where they're at and how they can be accessed. We've had a few situations over the years to where someone kept all their records from their CEs in their work email. They changed jobs and then said, I don't have access to my previous work email anymore, and it created some problems. And so this is a nice resource and a tool, but we also realized there may be people that didn't want to use a resource like this. And so the board did allow individuals to have the choice between using it or not using it. And so, but we did want to get some feedback from CE Broker now that we've had all 7 professions live for the last 7 months or so. And so we set up a meeting with them. And we did spend a lot of time in the fall meeting with representatives of their company to help them understand all the different requirements for CEs, the different categories that are required for all 7 professions. And so they built the system to match our licensees. And we wanted to know what has been the level of uptake so far. Now, one of the reasons how CE Broker can provide this free service is because optionally they also offer paid services. And so some people do choose to pursue the paid services. We wanted to make sure that everybody had the choice and had the option to have a free account. But if some people think there is a benefit to that, such as by being connected to more CEs or having additional services, there's enough people that optionally pursue that is profitable enough for the company to offer the free versions. And so in terms of uptake, the number that they had is about 1,757 licensees have decided to activate their accounts and are engaged in the system, which is about an 11% adoption rate. What they also reported back to us is what they frequently see is that someone activates an account very soon before the expiration of their license, which makes sense. Because when someone knows their license is going to expire, at that point, they can make a choice between doing the traditional renewal method or activating the account, uploading their hours. We had heard some feedback that it is time consuming, but I think part of that is for people that are not using it continuously, they would have to upload quite a few hours all at one time. And the first time you use any system is going to take some time, but we do want to make it more user-friendly for people. So it does sound like about 11% right now. We probably won't know the full level of uptake for about another 1.5 years because our licenses last for 2 years. So as people come to the end of their license period, we will get a better idea if they choose to use CE Broker or not. But
Can I interrupt for a second?
Sure. Mm-hmm.
Allison, did you do it? Because you were excited about it.
The thing is that I already renewed before we did this, so I have had no reason to get on there.
Okay. All right.
So
Just checking.
no,
I thought you
but I
could
did
give
get
everybody an
audited.
update.
But I did get audited the last time I renewed, and it was still pretty easy, like to just send Lydia the stuff.
Yeah.
Lois.
All right.
Lois. I was like, it's an L. I'm so sorry.
No problem at all. Yeah, and we are trying to make the CE Broker information a little bit easier for people to access to, because that was some of the feedback that we received from the advisory committees. So we are working on adding some language to those notices that go out, when a license is getting close to expiring. And so those emails that go out 90 days, 60 days, and 30 days in advance, we're adding a paragraph that says, if you do want to activate your CE broker account, that's an option where you can upload your documentation of your completion of your hours. So we'll add that to that letter there to give some more focus to the CE broker resource. And then also, people were asking about where that information is on the BSRB website. And initially we had sent that out to licensees by email and then posted a story in our news. But we realize as the news gets older and gets archived, it's harder to access that information. So we actually added 7 new postings on our professions pages. So if you go to the professions page, there's a section that has the renewal information, and on each one of the professions pages under the renewal section, there is now a new link to CE Broker as a resource. And if you click that link, it goes to the article that explains what CE Broker is, how to activate an account, and then how to upload things to that portal. So that'll hopefully make sure more people are aware of how to do it, and then put a more of a spotlight on it so people can continue to get engaged. But we hope more people continue to use that free service. We did also get a question about how many issues people have had in terms of technical issues using CE Broker. So we did want to find out if people were having problems with the system. They reported to us that when we met with them to that point, which I think was in maybe June, they said that there has been 26 total tickets reporting issues. And of those 26, 19 were from BSRB licensees, and then about 7 were from non-licensees. The reason for the non-licensees is that for the social work profession, currently there is a way for some of their providers to become pre-approved providers with the BSRB. And CE Broker had offered to allow us to have that be part of their system, where the providers could just go ahead and use their system to submit their application to become a pre-approved provider. So we had about 7 of those individuals submit tickets for assistance, and then about 19 licensees request assistance for technical issues. So I feel like that's pretty good. 19 licensees out of the 1,700 or so that have signed up for it so far. But we still want to make it more user-friendly. We're still looking, a couple of things we've heard also for people who hold multiple licenses. They were asking, is there a way to upload it once and then just click across to say, I want to take all these hours and apply them to another license? And unfortunately, there's not a way to do that. It treats each license separately, but that is something we'll ask about again in the future. And then there is a long-term goal. We probably won't be able to do this for probably another year to a year and a half. This is probably going to come along with our new licensing system, but our end goal is that we would like to have a live link between our renewal system and CE Broker, so that if you're doing your renewal electronically and you go through to the part to where it's asking you, have you completed all of your hours, we would like there to be a button that if you're using CE Broker, it will say, based on what I can see, it appears that you have uploaded all of your hours to the portal. Now, you're not required to use it, and it won't stop you either way, but it would be a live check for you to look. Allison, I see you have a question.
I do. So as somebody that I'm assuming that most of the licensees have other credentials, right? So like for BCBAs, we have the BACB or whatever I can't remember what the other one's called, QBS maybe. That's like their other credential that we also have to do literally all of the same stuff for, literally all of it, like uploading CEU certificates up into there. Is there a possibility of talking to CE Broker about like them backdooring that so that if I upload it on my BACB, it's already uploaded into my LBA and the other way around?
That would be very, very helpful, Allison.
It would be magical. In fact, unicorns might fly if that happens. But it would be really cool because I'm assuming that it's not just for BCBAs. I'm not being selfish, like just us BCBAs get to do that. But I'm assuming that there's other licenses or other credentials that they have to do the same thing for.
I think we're pretty unique, right, David?
Okay.
Well, in terms of holding multiple licenses, that is something that we probably have about 1,000 to 1,500 individuals that hold more than one license under the BSRB. We did kind of a look into that a couple of years back. And
But
I think
that's different
Yeah,
than
I'm
what
just saying like
Allison's
the
talking
outside
about.
entity. They would have to talk with the BACB about if there's like an interface that they could just communicate on the back end and I don't have to do anything. If I upload it to the LBA, it uploads to the BACB and vice versa. Now getting the BACB to agree to that might be problematic, but if we're talking
Yeah.
about future wants and hopes and dreams, that is a future want, hope, and dream.
Yeah.
Yeah.
Because I think we are unique, David, because I don't know any of the other professions that are required to maintain their certification, that they have to be credentialed with this external board in order to be able to get their
Oh.
Kansas license.
Yeah, that is a bit unique. I know for some of the associations, they have pre-approved CEs by some of the associations, but that is not something that's recognized in
There's
Kansas.
not like a national board for LPs?
You mean as far as
Or
No,
like
no,
psychology? Nothing?
Nope. I can be a member of APA, but
Oh.
I'm not required to submit CE documentation to APA in order to get a national credential that then I show to the BSRB in order to qualify for an LP. Right?
But APA is not the agency that
Correct.
does your license, your
Yeah.
psychologist license.
No, or even the
BSRB.
EPPP, which would be the ASPPB that David was talking about. They're the
That
ones.
was a lot of letters, Linda.
They're the ones. The EPPP is the national exam that psychologists and some other professions have to take in order to say that you're qualified to apply for a license in your state. Right? I passed that EPPP exam, which is like the BACB exam, right? It's a 4, 5, 6 hour exam. And you have to pass that exam in order to qualify to become a licensed psychologist. But they're not a credentialing body. They just say you took the exam and you passed it. Whereas for us as BACBs or BCBAs in Kansas, we need to have an active credential with the Behavior Analyst Certification Board that has the qualifications in order to be an LBA.
Right, but that's set forth by Kansas law, not the
Yeah.
BACB.
Correct. That's Kansas law, not the BACB.
I think, Linda, if I'm right, there's what is that called? The ABPP, right? But they are like board certified for different specialty for licensed psychologists. But the difference is that you do not have, it's not a requirement.
Correct.
You can pursue additional certification. Like I know like some of the people get certified as, I don't know, neuropsychology.
Yeah, that's a subspecialty. Yeah.
Yes, but they are not required to have that to be licensed. And us is a little bit different. We're like required to certified to be licensed.
Yeah.
Okay, sorry, I didn't mean to like derail the whole conversation. I just, if you're talking about future, I would love that because it's a real, I get annoyed once a year because my cycles are off. So I have the BCBA and then a year later I have the LBA because I was certified before the LBA was a thing. And so
I don't think you are the only one though, because
Yeah.
like the feedback, the survey feedback, a lot of people were talking about how if it's possible to even just make them like sync. Like
can I apply to like have them line up? Because I have
Well, Allison, I approached, and they may not do it now, but I was having the same thing with being an individual CE provider for here at K Med Center, and then my BACB credential itself. And I approached the board about it, and I said, look, I have all these things. They're coming at different times throughout the year. Can you align them somehow? And they did.
Okay.
So
I think the overarching point would be that the if there were a way to minimize the number of links in the chain, communicate everything and to make sure our qualifications are up to date across the various licensing certification agencies would be awesome. Although it's well taken that I suspect some of it will have to do with the technology involved with these different agencies or people using the same sort of technology, and also who foots the bill, be able to use the different technologies, just the way it is in the healthcare world, like portals for KU Med versus Lawrence Memorial Hospital versus, you know what I mean? They don't all speak to each other. Just about our
Proprietary,
medical records. Yeah.
But I'll ask a question. I'll at least see if that's something that they have been asked about, and see if that, how much of a possibility that would be. One thing from our perspective is when we reached the agreement with CE Broker, we needed to do a data sharing agreement as well. And so if you have two separate entities, then there might be data sharing that also would have to be involved with that too. But we can at least start that conversation and say, we know our licensees have already uploaded a lot of this documentation to a different portal. Is there any way that we can talk about, or you could pursue linking these portals, or at least asking for permission for that to be imported?
The really thing we can consider is that we have to do CEU requirements for them anyway. Was there a possibility of us just re-uploading, like, hey, I'm still certified, so clearly I've met the CE requirements because I'm still a BCBA. And I think the BCB or the BACBs is actually more CEUs than the LBA anyway, or I don't remember. Either way,
it should be the same.
We're still,
I think
I'm still a BCBA, so I'm still meeting the CEU requirements. Can I not show you all of those again, please?
Yeah.
I love that because I'm being audited right now. I have to try to fill out that form with all my CEs, which is not going to be even very sure. So if I can just show them, I just recently recertified, would that be good enough?
Please take my BCBA, because that's what the requirement is. I'm still a BCBA, so.
And on that one, I think the answer would probably be no, because I think that there's a separate regulation that talks about what's acceptable in Kansas. And my guess would be is that regulation is different than what the parameters are for the BCBA.
But can we think about that logically? If I don't keep my LBA, but the requirement to get the LBA is my BCBA, can I just go reapply with my BCBA again because now I've met it again because I'm still a BCBA?
And I hear what you're saying. I think there may be some standardization between the CE requirement regulation between the different professions.
I just like to poke you, David. It's okay. I know.
I'm always willing to have the conversations, though. You bring up good points.
Yeah, we get those emails about regulatory board members and topics. That would also be a good place to talk about it, because I'm sure Kansas is not the only state that has come up against this, right?
Right. Well, and we've had a similar question from some of the other associations. Like they have the National Board for Certified Counselors that review professional counseling CEs and do some pre-approval for that. But just because it's pre-approved by NBCC doesn't mean that it's going to meet our continuing education requirements, because we have a regulation for counselors. And the same thing, if there were another profession doing pre-approved, it doesn't necessarily mean that it meets the requirements in Kansas. But I would assume that there are probably some states that have adopted a rule. Now this goes into sort of sovereignty by states and delegation. Do you want to delegate that authority to a third party entity to do some of those approvals or not?
But we totally did already, because you have to have the BCBA.
Well, yes, but there's language in there, and that whole sovereignty thing was very much on the table when we were arguing the point to start with, when this bill first was introduced, and specifically around the CE's requirements and the certification, because Kansas will not delegate authority to a third party. Now, unless they've changed that, have they changed that, David?
No, I think that's partially why the unprofessional conduct regulations are that way as well.
Yeah.
Because for some, they have said, we will just adopt the association ethics codes. But for most of the codes that we've looked at, they have not been specifically designed the same way to look for unprofessional. a lot of them say our ethics code includes things like best practices too, like you should publish at a certain, every once in a while, and you should strive to be the best possible, practitioner you should be, which is not a bad thing. It's just the reverse. We would not punish someone for failing to be the best possible. And so there's a middle ground there. And that's why the unprofessional conduct regulations are written a little bit differently than some of the ethics codes. But definitely a good conversation to have. And if there are reasonable things that we can do with this, we'll look into it. So
thank you. So now I'm going to turn it back over to you to finish. Oh, Piqua.
I have a question. I know people usually wait until the 30 days to renew their license, but is there a regulate or requirement for how soon they can renew? Because the BACB has the 45 days, I believe. So if we can allow people to maybe renew a little bit earlier, then they can potentially line up the BACB, requirement. So I don't know. So, but I tried to look it up online, but I can't find it.
and I think this is true for all professions, but I will double check. What I've heard from staff is that you can renew up to 90 days in advance.
90 days.
When we send a notice at 90
But
days, and when it's
it doesn't change your date. It's
Correct.
yearly. It just
Right.
your next effective date is still like the date
Yeah.
after.
true. Yeah.
Oh, okay.
I tried that. I thought the same thing. Like, if I renew early, maybe they'll change the date. They sure did not.
Okay.
Nice try.
Well, I'll highlight a couple more things and then I'll wrap up my report. We did just finish all of our surveys. The biggest group of licensees we surveyed was the social work profession. There's about 8,500 or so social workers in Kansas, and we were able to get responses to our survey from 2,000 social workers. So really happy with that response rate. It was about 23 or so percent. And so that we are going through all of that. Once we have, that has already been turned into a draft report and reviewed by their advisory committee. But now that we have a draft report for all 7 professions, we're working on finishing the comparison report between all the professions. So once we have that, we'll have final reports for each profession, and then we can kind of put a bow on that project for this year and allow you to continue to do your work reviewing the results of those surveys. But really happy with all the response rate from all the professions, and I think we have some really good information. So in terms of some legislative updates, I want to make you aware there was a House committee that met recently. This was the House Select Committee on Government Oversight, and they met on July 29th. The focus of that meeting was on the operations of the Board of Nursing, but a lot of what they talked about is relevant to other regulatory boards like the BSRB. They focused on different practices and policies and procedures relating to, how we would alert someone when their license is getting ready to expire, and how we actually renew a license, and what we do as far as reinstatements. And in the afternoon of that meeting, there were a couple of individuals who had been licensed, and then through different circumstance, their license had expired. And then there was a question of had they practiced after their license had expired. And they both had been found to have practiced after their license expired and had a disciplinary complaint against each of them. They talked about this openly at the meeting, so I'm not sharing anything that's confidential, but this was something that they went and talked to the legislative committee about. And they said they had consent agreement orders that they had signed, but after they signed those and they were made public, they were having a difficult time with their malpractice insurance and also getting hired. And the committee was asking questions about, is it unprofessional conduct for someone to allow their license to expire? And there were questions about, why are certain agencies following certain practices and what's going on? And through that process, it was kind of shown that for the Board of Nursing, one of the things they did is they would send out a postcard when your license was going to expire, and they would send that out about 90 days in advance. But they didn't send out emails, from what I understood, unless you had signed up specifically for the email reminders. And it sounded like about 20,000 of their 70,000 licensees had signed up for the email reminders. So for the ones that had not, they didn't get an email reminder about that. And there was also a question of, were people informed when their license, became expired and what that meant? And so they had asked some questions to us ahead of time, This was a legislative request that I had received, and we had turned information around, but I didn't know if it was for a person or who it was for. It was just through the Legislative Research Department. But at that meeting, one of the documents that was put out there was basically the practices of the Behavioral Sciences Regulatory Board compared to the Board of Pharmacy, the Board of Healing Arts, and also the dental board. So some health-related regulatory boards. And it talked a little bit about, we notify people 90 days out, 60 days out, 30 days out. And then also we send a letter if someone's license does become expired. And it also, we wanted to clarify too, it's not unprofessional conduct if someone's license expired. We have a lot of people that will just choose to retire, or they might step away from the profession for a time for one reason or another. The real issue is, are you providing services that would require a license? Because if you're doing unlicensed practice, that gets into some really complicated areas that could involve fraud. And especially if you're seeking reimbursements, a lot of those insurance panels, from what I understand, one of the agreements in there is that you are providing services while licensed. And so if you are asserting that and you're not, that really is where the problems really come from. And so I think the committee was trying to understand what the complications were and the details. And while, BSRB was not the focus of that meeting, some of the things the committee was looking at, we want to be mindful of. We want to make sure if we can improve our processes and do things better, that we're doing that. And so we did get a compliment at the meeting. There was someone at the microphone who was licensed as a nurse, but she was also licensed as an addiction counselor. And she said at the microphone, she was critical of the Board of Nursing because of them only sending the postcard. But she said, I'm also an addiction counselor, and that agency sent me 3 email reminders that my license was going to expire, and she was complimentary of us. So I appreciate the compliment, but also, like I said, we want to be mindful that, we want to be helping people stay licensed when they want to stay licensed, and make sure that people know the information they need to know so they can stay licensed and continue to, we don't want anyone to accidentally fall into the unprofessional conduct realm. And so I want you to know that I was paying attention to that meeting. We're trying to look and learn from what other agencies are doing. But in case you had any questions about that meeting, I wanted to bring that to your attention. The legislature does stream their meetings on YouTube. So if you ever wanted to go back and watch a meeting, you could definitely do that. That meeting again was on July 29th. And then just a heads up about a couple of meetings next week. There's a couple of meetings that the legislature is going to be looking at health-related topics. I think the name of this committee is House and Committee on Health and Social Services. And they're going to be focusing on some staffing related to nursing and state hospitals. The Department for Aging and Disability will be sharing some information with that. I saw also there's a couple of individuals from some of the mental health professions, like Kyle Kessler from the CMHCs and Amy Campbell from the Mental Health Coalition. And so those meetings are going to be on, I think, Tuesday and Wednesday of next week over at the Capitol. One of them is scheduled to be an all-day meeting from about 9 to 4. The other one, I think, from 9 to 2:30. So we don't have an active role in those meetings, but since it deals with a subject matter relevant to the BSRB, I thought we would try to listen in as much as we can. And if there's takeaways from that, I'll keep you updated in future meetings. So any questions or comments about legislative items?
I do have one, and it's just sort of in general. When you send out email reminders and whatnot, if your license, for some reason, if you don't get the email notification and you miss your date, this happened to me with my license with psychology, is I thought it was getting sent in and it did not get in by the date. There is 0 grace period. And once you show documentation that you really did do your CEs and you pay the fee and whatnot, your license date changes. And it's probably more important on the LP side because there are some insurance companies that won't reimburse if you've been licensed less than 5 years. And but I do know that there are some insurance companies on the LBA side also that look at years in practice. And when you get audited, they want to know how many people you have with over 5 years of experience or over, right? So it's important because you do not maintain that date. And then it looks like, let's say you've been a BCBA for 20 years and you let it pass, you're now no longer, that's not your date according to the BSRB. So
Another sort of legislative update is that as I'm moving away from Kansaba, I am going to be working on a formal Kansas grassroots advocacy group that's actually going to hire a lobbyist as well. So I just want to give you guys an update on that. One of the things that we're going to be advocating for, I think originally, is a spot on the board for behavior analysts. So that's one of the first things that we've talked about.
anything.
I think that's important, and so I think it's important that this group knows that as well. There's a couple other things insurance wise, Blue Cross Blue Shield, blah blah blah, all of those things, all of the normal mumble grumble of insurance-based services, but I think that one was particularly relevant. I'm hoping to get that in for this next legislative season, but we'll see if we can get all of the ducks in a row and lined up first.
Great. Well, thank you, Allison. I just have one more comment for all of you. I do try to give you updates from the most recent BSRB board meetings. There's one item from the most recent board meeting that I thought was of note in particular. There's some other relevant things that you can take a look at the agenda, and if you have questions about, let me know. But a few years back, there was a bill that authorized the board the ability to require background checks for licensure. And that has been something the board has weighed multiple times at a time to which, you know, there's a drive for workforce. There were questions about, is this necessary? This is an additional fee for licensees, and is that going to create issues? Although there's also the public protection mission of the board, and if people are applying for licensure, we were asking them these questions, but is it necessary to have a background check to actually verify this information? And as we have been added to different multi-state compacts over the last few years, we are now part of 3 of those for the professions regulated by the BSRB. Psychology has a SIPAC compact, professional counseling has added a compact, and social work recently, there was a bill passed to add Kansas to the social work compact. One of those 3 is operational, the other 2 are getting closer to being operational, but all 3 of those do require background checks as a condition of licensure to be able to practice under those multi-state compacts. So if our licensees have not done that, they would be ineligible for 2 of them initially, and then the other one after a certain point. SIPAC allows a certain number of years to get into compliance with the compact. The other 2 have made the decision that if you're not licensed, if you have not had a background check, you can't practice under the compact until that has been part of your requirement. And then when you also look at our surrounding states and their requirements for licensure, the requirement of a background check appears to me to be a standard requirement for our surrounding states for the professions that I have looked at. So I encourage the board to, you know, I understand why this was something that they didn't make a requirement right off the bat, because they were being mindful of the other things that are, you know, being talked about. But I really do think, based on the public protection mission of the board, this is something that we need to come into compliance for the multi-states compacts, and then also because of our surrounding states and their requirements. And so we brought this to the board as a proposal at the last meeting. The board was in favor of making background checks a requirement for licensure. The statute is already in place. I have met with the Kansas Bureau of Investigation. They said we already have what we need to have behind the scenes. And so I'm just working out the details in terms of, you know, how quickly that can be implemented, what the details are going to be. The big takeaways are the authorizing statute that would allow the board to require background checks allows the board to require them for applicants on initial licensure applications. So it'd be for people applying fresh to become licensed. It would also apply to people that were trying to reinstate a license. So if they have previously had a license and it expired, or they had a suspension or revocation, those are all 3 situations where someone would need to reinstate a license. So in that case, we could require a background check. And then the other would be any kind of a disciplinary investigation that could have a background check requirement as well. But there's also a number of people that are currently licensed, and the background check was not a requirement for when they became licensed originally. We did not recommend to the board making it a requirement just when someone renews their license, or that they would need to do these background checks repeatedly every so many years. but we did say we would like the authority for having people opt in to do the background checks as a condition of licensure, because otherwise they would probably be ineligible for these multi-state compacts. So the board was supportive of that as well. But we're just trying to make sure that that is something that we're able to offer under our existing language, or if we need something else. But I've talked with the KBI a couple times now. I'll talk to them again. When we get close to being able to implement this, we will make sure that we know exactly how it will be performed. The cost of a background check would be $57, and that would all go to the KBI. So nothing is going to the BSRB for operations. We do think it will take some additional staff time for our staff to review these background checks, to make sure that we're noting they have been reviewed. And for the ones where there's no issues, we'll just put that into the system. Where there have been issues, that will mean we will be investigating additional complaints. And that will take some additional time for our investigators. So we don't know exactly what the impact is that going to be on staff time. But I just wanted to make sure this is kind of a change in our processes. It won't affect everybody who's currently licensed, but it will affect new applications. And we are pursuing that opt-in method so that people will be able to pursue a background check if they are currently licensed. So just wanted to go ahead and wrap up my report and see if there's any questions on that item or anything else that I talked about.
The only question I have is, we had discussed it a little bit at a previous meeting. And so for us as behavior analysts to pursue a multi-state compact, which would put us closer to where we were before we had the LBA process, that needs to come from an organization that out in the community, right? Not BSRB. So maybe something that, like what Allison was just talking about, her grassroots organization. And so I guess maybe something to put a bug in your ear, Allison, about that. And then David, is that something that as the executive director, you could potentially put Alice in touch with the organizer of the social work or psychology multi-state compact to see what it was that they had to do in order to be able to move forward with the multi-state compact?
So most of the compacts have been driven by different national associations, and they have approached the Department of Defense for funding. There were some grants that were made available for that. And so most of that was driven by, like for counseling, it was driven by the ACA, the American Counseling Association. And then they partner with some other groups in terms of having a group of people come forward once they have the grant money, and then work on drafting the language. And then some of the operations for the initial work of those compacts was sometimes set up by those national associations. But the role of regulatory boards really came in. A handful of them were tapped in to help draft some of the language for different compacts. Most of the initial startup was usually done by different associations at the national level, and then it kind of tied into the state level. So
maybe like the Association of Professional Behavior Analysts or something like that, APBA.
It's possible. Regulatory boards generally, as a regulatory board, weren't really involved unless there were states that had individual members of those that were part of the drafting team, or when it was actually all complete and ready to be passed in states. Then the associations might come to the regulatory boards and ask for support to work together to see about getting this passed in different states. And that's kind of what happened with the SIPAC compact, and then the counseling compact, and then the social work compact. So,
Alec, are you on, or are you out of your office?
I am here.
Aren't you hooked in with the APBA?
I am a member currently of APBA, but I'm not on any board. But I do know board members if we need to contact somebody.
Yeah. So you might just, and I don't even know if that's something that you would bring back to this group. So David, here's a question, because that's not something that we provide recommendations on. So if Alec checks with the APBA, is he able to reach out to other members on this board about that issue without it being considered official behavior analyst advisory board function?
I would think that if you were not doing this in your capacity as an advisory committee member, if you were in a role with a different organization, that would be kind of separate. I realize that it's a little tricky because
Yes.
there's work. So officially, this advisory committee really wouldn't be able to advocate. So when it comes to advocacy, that's not really the role of this advisory committee. So this one is really more of making recommendations to the board or going through informational type things. So if you were trying to organize something outside of this and other roles for other organizations, I think that would be something outside of your advisory committee membership. So I would think that would be fine. You would just need to make sure that it doesn't cross over into, topics that we would talk about for an informational purpose or educational purpose through your work of the advisory committee.
Okay, thank you. All right. Any other questions for David? David, do you feel like you're on the hot seat?
You're being really hard on you today. I'm so sorry.
No, seriously.
It's perfectly fine. No,
And he's a really nice guy too.
It's very nice.
happy to help.
All right. So with no other questions for David, we'll move now on to old business. So now we're going to continue to review and discuss the draft survey of licensees. And you all should have gotten the email with the questions in it. David, you want to talk about that?
Yeah, and Linda, if it's okay with you, at the beginning of our agendas, it always says if we need to move items around, we have the flexibility to do that. Just to make sure that we are able to kind of get through these first two items of the meeting today. Do you mind if we move those two items so that we talk about the advisory committee member first for that discussion?
Oh,
and
yeah.
then talk about the agenda or the survey report second?
Yep, absolutely.
Okay.
So that would mean, I'm okay with that. So that would go under that we would move item 6A up for discussion so that we can get through that. Are you guys okay with that?
Yeah, so this would be moving 7B just to the beginning here to work on that one first. So.
Oh, sorry.
But yeah, we always include a little language at the beginning of the agendas that says, the BSRB may take items out of order as necessary to accommodate the time restrictions of members and visitors. So.
Yes. Okay. Yes.
Okay. Well, then in your packet of material, you did receive a copy of the advisory committee policy, and you went through a discussion of applicants for the advisory committee at your last meeting. We talked about the requirements in terms of the makeup of the advisory committee, that there is the board member for that profession if one is on the advisory or one is on the board. In this case, since there's not a behavior analyst on the board, Linda is the chair of this advisory committee. Officially, she's on the board as a licensed psychologist, but she also is licensed as a behavior analyst. So she is the chair. And then we have a public member on the board, and that is Denise. And then the remaining members, I serve as an ex officio member, so I don't vote. But the other members on the committee are at a minimum 3 and at a maximum of 10 individuals that serve as advisory committee members. And you currently have, I believe, 9. And so there is spot for one more advisory committee member. And you had a discussion last time about potential candidates. We had put out a letter to all licensees for individuals to apply for consideration. And so one of your recommendations last time was for Piqua to be recommended, and the chair did appoint her to the committee. So she is able to participate in this discussion and also say who she would recommend to be added to the advisory committee as well. But you do have a spot for one more person. So I'll turn it back over to Linda, and then she can guide you. The only requirement is, as you're looking at candidates, the advisory committee does talk about some of the criteria to kind of weigh when you're looking at that. And then also, if you were to take a vote, you couldn't do a secret ballot. A vote would have to be in person, but you could also reach conclusions by consensus too. So if there's someone that stands out to the most people, you could reach it by consensus without taking a formal vote. So I'll turn it back over to you, Linda.
Thank you, David. And so last time we had a fairly robust discussion on some of the different members. And we agreed that we did want to add 2 members so that we were at capacity. I like the fact that we're bringing on Pickwa and potentially a new one now, because then that's sort of mid-cycle for some of you guys. So if you end up transitioning off, we don't lose all our brain power. So were you guys able to, speaking of brain power, give this a little bit of thought?
Have we checked with all of them that they're all still interested? Because I know the applications for this was a while ago. And from experience, I think one of these may not actually be interested anymore.
Well, that may be the case. And if it is, then if that person happened to be the one that we selected to extend an offer to, I think then that David would extend the offer. If they declined it, then he would bring that back to us and we discuss it again at the next meeting. Is that correct, David?
Yeah, I think that would be nice. We could handle it that way.
And just for clarification, none of the, because I did look through all of them, but I'll be honest, from the last meeting to this meeting, I did not cross-reference. None of these were new applications, correct? Okay.
Correct. Yeah. And so, part of it is in, just taking a minute to look through these. What we really want is a good representation across the board. Pickwa and Emily, you guys have experience in schools. Allison, you're a home and community-based provider, as you are, Kelly. We've got Pam and Pickwa, who are university-based, and Alice at the Med Center. Alec, we have you at Children's Mercy. So we have 4 members who are university-based or higher. I know that I think, Emily, I think you're the lonely MA master's degree. I think everybody else has PhDs. Is that correct?
Oh, I was gonna say she was the only school one.
No, Pickwa has experience in schools.
Oh, that's right.
But yeah. But I think you're the only master's level one. So I was thinking, I think I was falling asleep last night thinking about that. But that might be something to take into consideration, as well as thinking about what the qualifications are for who we have, and thinking about adding another master's level clinician so that your voices are just as amplified as those of us who are really vocal.
Well, I was going to say one thing. I always knew that I seemed to be the least expert in the field in this group. But the other piece that I was looking through too was I only saw one person. Most of them seem to be in the Kansas City area, correct?
No.
Well, Holly Kramer, I think.
Holly's not.
Wichita.
Daniel's not. Kylie's not.
Okay.
I mean, Kylie might be now, actually.
I think it did say like Kansas City area. I thought it said Shawnee. I could be wrong. North City is where her address is.
But yeah, then the rest of them are Kansas City. Does Holly's a master's level, right?
I think Holly is a master's level.
Danielle is a master's level.
Danielle is. I believe Amy Sanner is. But
what's
she's
Amy Sanner doing now? What would she be representative of? Home and community based?
Probably. I don't know if she's currently. Yeah, she's in Shawnee though. Early intervention specialist, autism from the start. So she's the chief clinical officer. So
I'll be honest, my preference would be, if we're looking for master's degree clinicians, would be Holly or Danielle. I think Holly I know Holly, I think, is at the same place that Kelly is though. So they both work the same. We do have Nikki on this committee though, that is a BCABA, but we only have the one master's level clinician. So we've got the bachelor's covered.
And when I was
Danielle or my two preference.
I was looking through, I was kind of leaning towards Danielle as well, not thinking about the master's level, but she is a master's level clinician, but also because she's in Wichita, which we don't tend to have a lot of representation in a very large section of the state from Wichita.
Yeah.
Me and Nikki are both from Wichita, but
yeah. You don't count.
We do count, but we tend to be heavy here in the Kansas City area. So another heavy representation in the other largest place in the area.
Yes. You know, I think Danielle would be a good voice. Does anybody have any other considerations, or do we have a consensus that Danielle would be a good applicant to extend an offer to?
I just wanted to throw out, I would support Danielle as well. But Holly and I, although we're at the same company, we have different positions and we also work in different areas across the state. So I'm based here in Lawrence and do Topeka, Bayshore areas as well. She's out in Russell, Kansas, and is much more familiar with like the rural areas out in Western Kansas than I am.
Rural provider?
What's that?
Other than Linda, she doesn't count because I don't count, apparently. It's fine.
For a rural provider?
Other than obviously you. I mean, you're not really that rural if you're doing Topeka, Lawrence.
Yeah. I think it's interesting, like Topeka and Lawrence and Bayshore, they talk about them as rural areas because of the lack of services, as opposed to the like actual population.
But I think Russell would be both of those things.
Russell, is going to be more of like the barriers that you more experience in rural areas. So I don't know. That's why I wanted to throw out that I would definitely support Holly as well. Yeah.
So I also know that Danielle like goes out to Dodge, right? So definitely Western Kansas.
I don't care between.
Yeah,
either
I think they're both. I think
worked
either
with both
one
of
are.
them many times, and Holly's currently on Kanzaba. She's our full member rep. Danielle is not, so
it would be nice to still have a tie to Kanzaba.
Oh,
I was
it's
thinking
just
that
me.
when you said
Well, we
that
do.
you were transitioning off. We do.
I mean, I'm in my outgoing year now, and I'll probably
Well,
still
whole
stay
year. Okay.
previous, like after that, but I'm just not. I'll probably be the legislative chair with my
You
title.
know, so one of the things that we could do is because this comes up each year, and like Danielle applied last year as well. So we could, if we offered it to Danielle, then when the next opportunity comes up, our collective memory will remember that Holly applied twice.
I think Holly has applied twice as well.
Oh, has she? All right. Well, then how do we do this where it's a drop in the hat, David? And
Somebody flip a coin. Somebody
flip a coin.
Probably not the most appropriate way to select someone.
Oh, I don't have it. Well,
she's really looking for a coin.
I am looking for a coin because it pretty much is like a.
They also just have very similar experiences too. So
I swear I have a coin here somewhere.
If you really want a coin, I think I actually do have one, but I don't know if that's the best way. David's looking very nervous about this decision.
No, I was just going to say, there is an odd number of members here today. So if you wanted to vote, there could be a vote. If you want to do it a different way, you're welcome to do it a different way, but that is an option on the table for you. So
have a coin.
I'm uncomfortable with flipping the coin.
All right.
She
All right,
said,
just be professional about it, Denise.
I'll throw out, if I had to
just vote on
lean
it.
one way, I would go Holly, only because I think she has a little bit more of that rural area versus Danielle, who, and I don't know Danielle at all, but just based on the CV, looks like Wichita based, and we have two from Wichita. If I had to lean one way, that's where I'm at.
I'm with you, Kelly. So
I'll third that, I guess. I'm looking at her CV and I see Oakley and Hayes, and those are quite out there in
Uh-huh.
the world of Kansas.
Emily is shaking her head yes.
So I mean, we have 4.
So is Pam. That's
I
5.
also vote for Holly.
And 6 and 7. So it looks like we have consensus.
Tell Danielle that keep applying, girl. Keep doing it.
It's a very close choice.
Yeah, but I'm glad that wait, because let me open up her resume again. I already closed it. Yep, master's degree and MS. So I just think that was important that we have more than one master's level person on here.
And if Holly says no, could we decide that we're then going to offer it to Danielle?
I believe so. Can we do that, David?
I'd be happy to put that forward and reach out to Holly first and say the advisory committee recommended you. Are you still interested in serving? And if she says no, then I'd reach out to Danielle. If that's your recommendation, I'd be happy to do it that way.
Okay, that is our recommendation.
Okay.
Comfortable.
Great discussion, guys. Thanks for keeping me in check. I'd be out here flipping coins. Thanks, Denise.
I was definitely joking when I said it, and you took it
I-
serious. So just putting that out there.
Well, and what I take away from that is that they're 2 very good candidates, and
Yes.
so one of the tricky thing is that when you had too many voices, it's hard for everybody to be able to fully participate. So there has to be a limit at some point. But it's nice to know so many talented people want to serve in this committee, and there should be openings in the future. So we'll make sure to communicate that to Danielle.
All right. Well, there you have it. Any other discussion on adding another member to the advisory board?
No, that went way faster than last time, though.
I know it did.
I feel like it took 2 hours, like the full 2 hours last time.
Well, and I don't think last time we took into consideration that master's degree, but I was thinking about it and I thought we're heavy on the PhD side, and that's not fair. So
To be fair, I wasn't a PhD when I started on this committee, so
that's right.
I'm
Just saying. All right. So back to item on the previous agenda. It was A, but now it's 7B, which is the continued review of the draft survey of licensees. Are you all good with moving on?
What are we doing with this one?
We're looking at it, David. Recommendations.
Yeah, so I'll frame this conversation and I'll share my screen here and pull up a copy of the draft report. So at the previous meeting, we talked a little bit about the report on the survey of licensees. And your report is one of the relatively shortest at 56 pages, but that's still a lot of material to cover. And so what we did is we asked a series of questions, some focused on workforce, some focused on trying to identify negative issues or problems or areas to where the board could look to have discussions or look at making improvements. And we organized these reports with summary information towards the beginning, but we also wanted to preserve as much as possible the voices of the individuals who were generous with their time in giving us feedback to the survey. And so what we did is to make sure that we can really have the advisory committees discuss these survey reports. We decided to limit conversation to about 2 questions per meeting. That way you don't have to think you need to cover the entire report and all of this information at one meeting. And so at the last meeting, we talked about organizing your discussion for this meeting on 2 questions. And the first begins on page 18 or 17 and 18. So I'll go there. One of the questions that we had asked all the different professions was, this is question 15 for both professions. Over the last 2 years, based on your observations and experience practicing the behavior analysis profession, could you share information on any practice-related issues you've seen, such as areas where practitioners appeared to need more continuing education or training in a certain area? Please explain. And so I'll just make a note about the summary information here. We did ask this to both the assistant behavior analyst as well as the licensed behavior analyst. We had a small group of assistant behavior analysts respond to the survey, so there were only 3. But of the 3, 1 indicated observing no practice-related negative issues. But the other 2 identified a previous employer with some unethical billing practices, and then also reported that issues have been seen in the area of trauma-informed care and socio-guided needs. For licensed behavior analyst, 56 LBAs answered the question. 3 individuals indicated experiencing no practice-related negative issues, but for those that did note negative issues, the most common responses were supervision issues, agencies and/or individuals providing behavior analysis services without proper education and/or licensing, insurance issues, lack of staff support, billing fraud, burnout, and lack of consulting opportunities. Also, ethical issues such as practicing outside the scope and conflicts of interest were reported. And then in terms of areas where people needed more education or training, it was noted that these were the topics that were noted: working with schools, treatment, trauma-informed care, collaboration, autism, telehealth, managing RBTs, dual relationships, neuroaffirming care, behavior plan writing, soft skills, and assessment. So I just wanted to frame that by talking about the summary information from the report, but I hope you've had the opportunity to review the open field responses and get a feel for the tone of the individuals who answered those questions. So I'll turn it back over to you and see if you had any takeaways or thoughts for this question first, and then we'll talk about the second question after that, but we'll turn it over to you and ask if you have any takeaways after reviewing the information from the survey on this question.
And the discussion is that we agree. What is the discussion? Like, what are we talking? Just talking points around those, or are we talking about formulating a response to those, or?
Yeah, so I think this is what our staff members took away in terms of reviewing the open field answers. And I'm curious if you have thoughts looking at this information and also working through the open field responses. Some of these things might be areas where the BSRB could add value or, come up with some different processes. Some of these might be things that are outside of our jurisdiction, but potentially we could seek to have a conversation with another group and say, our licensees identified these things as problems. Would you be willing to work with us in terms of solutions or things like that? But I'm just curious if anything struck the members of this committee just in general. And then we could also look at, are any of these things that maybe the advisory committee could focus on for future meetings as we look at possible recommendations back to the board. I think that's the ultimate goal, is that these surveys could drive the work of the advisory committees and the board if we find things through these responses where we see a number of people indicate a problem in this area. And then once we've identified the problem, then we could start talking about possible solutions.
I mean, I'm gonna jump on back to my TCM issue. I think I'm the one that wrote the people practicing outside of their scope by targeted case managers writing behavior intervention plans for individuals. But in other conversations that you and I have had, it sounds like that's not really something that the board's going to be able to address because they don't then license them. So how would the BSRB police that is kind of my question. Like, what's the next step for that? Because that's also one of the issues that Kansas Grassroots is going to be addressing, like one of the very first things. So, Linda, if you're talking, you're muted. I see your lips moving. But...
Thanks. I think there's a song like that. Your lips move, but I can't hear what you're saying.
Probably.
Yeah. I think that that's probably one of the discussion points. Like, if in fact we think that no other profession has the capability or the skill set to be able to conduct and develop a function-based behavior intervention plan, except for behavior analysts, then the that becomes, I think, a legislative topic, right? Which then could be a recommendation from the advisory committee to the board to propose that David draft language, right, to present to the legislature that would limit any profession in the state of Kansas from developing a behavior intervention plan except for behavior analysts.
I don't think that's my recommendation.
I'm using that as an example,
Okay.
right? I'm not saying that you, Allison, are saying that. And I purposefully used broad language so that it was, you know, something that would reach the magnitude that we think that we would recommend that there be language drafted. I think in looking over this, there's a lot of, I think the other area that we could discuss and recommend would be, there was a lot of negative scope, not just with question 15, but also with question 17 about, have you experienced any negative issues with supervision? Supervision came up in both those questions, right? I mean, that's the thing that jumped out to me. And so then, David, the question would be, like, we discussed this as a group and think that we want to have a little bit more, we would like the BSRB to have a little bit more oversight on the supervision practices specifically related to licensed assistant behavior analysts, right? So that, you know, we're having them provide documentation of the supervision meetings that they are having with their supervising BCBA. Or it could be, and once again, I'm just totally making this up. It could be that in addition to RCEs that are currently required, that we have ones that are specifically surrounding that BCBAs need to take additional CEs on ethical practices and supervision. Is that, am I hitting the mark there, David? That those would be things that we could discuss and recommend?
Yeah, I think so. And to me, I kind of think about it in two different phases. We have a lot of individuals that provided individual responses, and we're kind of looking at all of this together. And, if only one person noted a problem, that may be a problem that needs to be worked on. But when you start seeing a number of dots in a certain area, it feels like that is kind of, I mean, to me, I start saying, okay, well, I see a pattern of concern in this area that really is something that not just one person noticed, but a number of people are noticing. And if these people that responded to the survey are noticing that, then probably people who didn't are also noticing that. And so maybe that's an area that's a concern. And then kind of as a phase two, it's like, okay, we've identified a concern. Now what's the solution to this? So I wouldn't necessarily jump to what solutions we can come up with immediately. It may be worth it to kind of just take our time thinking through identifying the big problems and maybe trying to figure out a few different things that emerge as problems in this area. And if there are things that we can group together, then I think the next step would be the solutions. But that's kind of, it makes sense in my mind.
Yeah, because some of the stuff, if you do scroll down, it's on page like 40 of that packet where the individual responses are. And there are some of the things that are on there that we do not have jurisdiction over, right? However, it comes up on a regular basis, and do we have anything in our regulations about appropriate billing?
Under unprofessional conduct,
Yeah,
I would think so.
yeah,
I can take a look.
because, that comes up a couple of times. But,
Well, and just-
insurance issues that we can't do anything with that.
Yeah, and for some of the other professions, just to kind of give you an example of how we can maybe piece some of this together, which may help to kind of think about when you're looking through this lens. Some of the other professions have worked on creating a supervision manual. And so it is something that is not a required thing that people have to use when they're doing supervision, but it is a tool that I think social work developed one first, and then marriage and family therapy and professional counseling will be meeting to work on that. But it's basically sort of um, giving some guidance to people that are serving as supervisors, and then also the people that would be receiving the supervision. And so some of the areas of focus like emerge in terms of the problems here, maybe that could be something that we would encourage supervisors to work with their supervisees on in more detail in terms of the supervision relationship. So that could be something too.
So how would we like to proceed then?
Would it be
Yes, I'm
worth?
still a little bit, oh, sorry.
Oh, that's okay, go ahead.
Okay, thank you, Pam. I guess I'm still a little bit confused about what exactly we can do, other than like discussing it. And then, David, can you help us, like, give us a little bit more like concrete guidance about like what potentially we can do? Because like some of the things they talk about CEs, and those type of things. I mean, we can recommend that, but do you have to change the legislation to change the CE requirements and to specify you have to have CE on this and X, Y, and Z? So yeah, I just wanted a little bit more clarification.
Yeah, and I mean, and I think we could even brainstorm, creative solutions too, because some of this could be that once the report is in the final form, we could share it with the behavior analyst associations and maybe even some of the CE providers that are out there and saying, some of you are providing content already. We're looking at our report and we're seeing that people in the field are saying there needs to be more emphasis on this or that. So if you are designing new CE programs, think about this. Now, we can't require people to offer those, but maybe if that's something that we can provide as just information as a service, then other people can pick it up and say, oh, well, maybe that's an area to where I can develop a new CE. Because I think with our jurisprudence project, we're going to be working on, that'll be an area for us to highlight, specific statutes or regulations that are rules in place. But some of this just might be, we can put a spotlight on specific problems. And then even if we don't have the control or the authority to solve them ourselves, we could start new conversations with other groups. So that could be part of the dialogue that we have as a committee that would say, let's recommend to the board that we specifically share this report with this group or with that group. And then encourage the board to have a dialogue with that group about helping them make sure they understand what we're seeing in the report, and then maybe they can work on some solutions as well. So
Cool, that's helpful. Thank you.
You made a point earlier, David, about trying to maybe better define categories of what the presenting problems are from these data before trying to determine specific solutions. It seems to me that's probably the first thing maybe we should try to do to filter more these open responses entries, because some of them are not all of that informative, right? So one says telehealth services, another one says telehealth and insurance services. So we just sort of know general category, but not a specific negative issue associated with that category. So if we could drill down and make the smaller number of categories that account for the problems, then starting to identify what other agencies are already addressing those. For example, the supervision manual idea I like, but we probably I would think we don't want to reinvent the wheel if other agencies have similar things in play, because there's a supervision manual put out by the BACB, and that sort of thing. So it might just have to do with what you mentioned, us reporting our findings to these other agencies that are currently addressing them, at least initially.
And this, I don't want to put more work on your staff, and other people might be more fluent with PDFs than me. But if all I had was question 15 and 17, along with the open-ended comments following it in a manipulable format, then I could move the stuff around by topic area, and then we could start seeing, some patterns, or these are items that we could come up with a recommendation on, and these are ones that we don't have any jurisdiction over, like telehealth or insurance or a burnout. We can't address burnout or child and adolescent development. I mean,
Mhm. How about if
that
we-
would
Are you
help
suggesting
me.
that- Sorry, go
Sorry,
ahead.
go ahead.
I was just asking, or what you're saying is like, could we take this table and quickly put it in Excel?
Yeah. Oh, thank you. Yeah, there you
Or
go.
we can just put it in ChatGPT.
I was just gonna say, Google AI suggests the way to
Good
do it
idea. Good
quickly.
thought there, you guys.
Yeah.
Gemini is really good at that.
Yes,
yeah.
I'm doing it right now, so I will see
I
what
nominate Alice.
Yeah.
Well, to make sure that we cover both questions for today, how about if we just kind of briefly move to the question 17 that dealt with supervision?
Yeah.
I'll just highlight that one, and then I'll kind of talk about maybe a thought for the next meeting. So here's question 17, and we did talk about that it deals with supervision over the last 2 years. Have you experienced any negative issues involving supervision? For the 3 LABAs, 2 of them indicated having experienced no negative supervision issues. 1 respondent reported experiencing negative issues involving supervision. Specifically, they had a supervisor who encouraged more reading or study hours than hours gaining real experience. For the LBA responses, 54 LBAs answered the question. 38 respondents indicated experiencing no negative supervision issues. One thing that we did notice with some of the other groups is, so the question does say within the last 2 years. So potentially, there may have been issues with supervision that were older, but if they weren't within the last 2 years, then some of them didn't report it here because it did basically say within the last 2 years. So that may have been a drafting issue, but maybe not. But at least in the most recent period of time, 38 indicated no negative supervision issues. But for those that did, the most frequently reported issue was inadequate supervision. More specifically, licensees reported a lack of constructive feedback and support from supervisors, and supervisees being under supervised. While negative issues involving supervisors, there were comments regarding there being a lack of training and support for those in supervisor positions. And then, while less frequently identified, other licensees pointed out the following issues: recruitment issues, burnout, poorly trained licensees, general unprofessionalism and or unethical behavior or practices, and also that RBTs are poorly trained and practicing without supervision. So just kind of wanted to highlight the summary information. Aside from what we've already shared a little bit about the topic of supervision, do you have any other takeaways for the meeting today concerning the open field responses for the supervision question?
I have a question, I guess not related to this. I'm happy to offer to, clean up the questions and send a summary, but just to be, clear on the process, I can send that to you and then you can share with everyone, right?
Yeah, go ahead and
Okay.
if you want to do a little bit of work on it, go ahead and send it to me directly, and then I'll distribute it out to the members of the advisory committee so they can take a look at that for the next meeting.
Okay, so the 2 questions is the negative experiences in the supervision.
Yeah. And I'll just let you know, we were gonna have a little bit more homework for next time. So I'll tell you what those 2 questions for next time the other advisory committees are focusing on. We are asking the other advisory committees to take a look at question 16. So go ahead and take a look at that one as well. It says, over the last 2 years, have you experienced any issues concerning telehealth, either through professional practice or observations of other practitioners? So go ahead and review the summary information and also the open-ended responses for the telehealth question. And then additionally, question number 18. Question 18 says, do you currently use artificial intelligence in your practice? And if you do, in what areas do you use AI? So we've talked a little bit about AI in the past. Now we can really focus on AI by going through those results in the survey. And then we had an item on the agenda under old business that was regulation of artificial intelligence. I'll just touch upon that now. I was just going to provide an update to all of you. We had previously talked about the federal legislation that would have prohibited states from regulating artificial intelligence for 10 years. As I understand it, while that was passed in the House version, when it went through the Senate version, that language was removed. So to my understanding, that's not something that we need to worry about for right now. It could emerge again in future possible federal legislation, but at least for now, that is not something we need to worry about interfering with our work as an advisory committee. So wanted to kind of tie up that item for you as well.
I was really interested in the AI one, so I kind of take a look at it already, and I feel like from the open response, people are using it on a more secretarial type of work, like scheduling, note taking, giving you summaries and stuff. So there's when asked if they are doing it in the practice, a lot of them are saying no, they haven't been moved there yet. But I know that the trend is because there are a lot of companies already offering AI session notes, all those things. So I am very interested in that, and I plan to do a survey, just kind of like collect information from BCBAs and practitioners on how they use AI in their personal and their practice. So that can kind of like help. Hopefully, that will help to provide us some exploratory type of understanding of how AI is used. But that was very interesting. And then I think right now, yeah, go ahead.
I think it's important to realize that this survey was also like 6 months ago now, and AI has changed dramatically over the last 6 months. It doesn't feel it, but the amount of like difference between the AI today and the AI 6 months ago is actually tangible. So I think it's important to remember that too, that I think that if we sent the survey out again right this moment, that those answers would be different, because my answer is different now on how I use it. So anyway.
Yeah.
Well, good comments, and appreciate all your thoughtful discussion on the survey today. And let's continue to kind of review this a couple questions at a time, and then we will work on transitioning this from a draft report to a final report. So we'll try to do a little bit more analysis and clean some of this up. And but yeah, appreciate your review on this. And if we can dedicate a little bit of time to each meeting, we can handle other things while we're going through it. Linda, I think you're muted currently.
Which is unusual because it's really hard to mute me. Anyway, good topic, good discussion. I think that what we're talking about is a really worthwhile activity for us to do. Thank you, Alice, for volunteering to continue to work on that. AI is a big thing. We've talked about it several times. I think we actually used AI, Allison, to generate I thought it was on here. Did we not keep on here something on the website? I don't
So-
think we ever voted on it, did we?
No, at our last meeting, we had individuals volunteer to draft language for a description of the website. I reached out to the individuals to see if they could go ahead and have that language for us to discuss at the next meeting in October.
Okay. All right. Because I thought it was still on here because Allison and I had used AI to generate a pretty good layman's description of behavior analysis. So that will go on the next agenda then, as well as to continue that discussion. All right.
Probably need to put that we generated that from AI underneath it.
Yeah.
FYI.
Yeah.
Linda, could you send that language to David such that he could share it with the individuals assigned to draft language?
Yeah. Allison,
Okay.
do you still have that in an email? No, I'll look.
I mean,
for it.
I emailed it to David originally, I think.
Okay.
I think so. I think you did.
Yeah, and I think the focus of the current language is really looking at our levels of licensure, since we have 2 levels of permanent licensure, and just kind of making the language kind of a little bit more descriptive in terms of what we have in Kansas. So
Yeah, I think the AI generated one that we had sent over might be a good base that you could send to that person.
Okay.
And see, and if you can't find it, I'll look for it too.
Okay, that sounds good.
And to be honest, I suspect the people assigned to this task could also generate it if you don't have it right at your fingertips.
Yeah.
Thank you.
It was a pretty simple prompt. Please
It
develop
was, you know.
a very easy layman's term
And I
description.
heard there's somebody out there by the name of Claude.
That's Android's AI.
Yeah. So
Everybody has
that. Yeah, I know a couple of people that call Claude their boyfriend. So
Are you on TikTok, Linda? Are you
I am
watching
not.
the psychiatrist that fell in love with her, or the girl that fell in love with her psychiatrist? That's
No.
her that she calls her boyfriend.
That's funny.
It is funny. It's highly entertaining.
All right. Well, we're 5 minutes away from the end of the meeting, and we have some items still left on here. So I think if you guys are all okay with it, I would like to move them to the next meeting. Like, I do believe that a discussion on alternative pathways for licensure would be something that we would all have a strong voice on. And I don't think we would be able to accomplish that in 5 minutes. So are you all okay with us moving that out? That'll give us food for thought for the next year. And then just so you remember, your homework is, Alice, you've volunteered to manipulate the question 15 and 17 for us. You're going to send that to David. And then for the next meeting, we're also going to do 16 and 18. So make sure your draft survey responses stays open on your desktop. So you have to look at it every day. And then, David, you're going to keep us posted to see if Holly accepts. And if not, you're going to extend an offer to Danielle, correct?
That's correct.
And then,
And actually, Linda, officially, so these names will be referred to the chair of the board. I'll
Right.
make sure that they're both still interested in being appointed. And as long as Holly's still interested in being appointed, I will forward her name to the chair of the board. If she's no longer interested, I'll talk to Danielle and see if she's interested. And then ultimately, the chair of the board has authority to appoint members to the advisory committee. So
yeah.
we'll kind of follow those steps.
Okay, thank you. And then everybody continue to think about artificial intelligence, and remember that next time we're going to finalize language to go on the BSRB website.
And Linda, I just have one note about the next meeting too. At the very bottom of the agenda, under the heading of next meeting, you will see, if you look at the bottom of the page, and then it kind of continues to the top of the back page, I listed 4 regulations there. So basically, over the last few years, we've been trying to be diligent about bringing regulations to you to review as a committee, talking about things like unprofessional conduct, continuing education, definitions, educational requirements for licensure if it was applicable. And so we have a handful that are left over that have not been reviewed in a few years. And we would like to be able to say that we brought all of the regulations to the advisory committees to review and provide feedback on if they would like to in the last few years. And so I looked to see, had there been any that I didn't think we had specifically brought to the advisory committee. And so I identified these four. They're pretty standard regulations compared to most of the other ones. And I think some of them are relatively short. So just read through them between now and the next meeting. At the next meeting, we'll also have our staff review them too and see if they have any recommended changes. But we just want to make sure we're being diligent in terms of reviewing these. And if there's no changes, that's fine too. Just want to make sure you've all had a chance to put eyes on them and then provide feedback if you wanted to.
All right. There you guys have it, your marching orders. Is there anything else that we would like to discuss in the 30 seconds we have left?
Nope, I motion to read it. Oh, Kelly.
I didn't even
I
have
have
that.
1 30-second. I promise it'll be 15
Okay.
seconds. I just wanted to share that I'm expecting my first child in September. And so I will not be at the October or December meeting, but I look forward to joining all of you again in 2026.
Awesome. Congratulations. That's fun.
Thank you. Thank you.
Oh my God, congratulations, Kelly.
Thank you.
That's exciting. All right. Thank you. Thank you for that. That's a positive way to end our meeting. And Allison made a motion.
I sure
Do I
did.
have a second?
I second.
Second that.
Pam signaled first.
I said this one. Bye.
All in favor, flash the peace sign.
Aye.
All opposed? Cutthroat? Oh, motion carries, David. Our meeting is adjourned at 3 o'clock straight up.
Damn.
Sounds great. Thanks,
All right.
everyone.
Weekend.
Bye,
Thank
everybody.
Have a
Sounds
great
good.
weekend. Good to see everyone.
Good to see
Bye.
y'all. Bye.